Welcome to Season 1 of Ticker Talks, the must-listen video-audio podcast for all things heart health from a patient's perspective. Let's grab our headsets and join our host, Big Northern Bear, as he explores game-changing insights or personal experiences from experts and individuals who have faced cardiac challenges. Don't miss out on the key knowledge that could transform your understanding of cardiovascular health. Now, get your headphones on. Let's start this week's show.
Hey everyone, this is Big Northern Bear. Welcome to Ticker Talk. I'm going to try something a little different today for the podcast because one, I'll be filming my face while I record it because I might do a YouTube upload of the video contents, or I might not. I don't know. But this is going to be a more free-form kind of rambling video podcast. And those don't really do well on YouTube. YouTube does much better with a scripted thing. But I've got this book in front of me that I think will become, or should be, your new cardiac health Bible. So I'm going to go through that. And I had this whole script written, about 10 minutes long, all the talking points I wanted to hit. And every time I started flipping through the book, I realized I need to add more. And I don't think that's the right approach, because I think what you need to do is just get comfortable and just let me go through this book with you. So I'm going to go through the index. I might flip to a few pages, but this book I found to be profoundly useful for me. Now, the book cost me $80 Canadian for a 280-page softcover. So for me to buy this book, I've had to have heard good things about it. So because that's actually pretty steep for an $80 softcover, right? But I feel like I've got my money's worth, and I've done something I rarely do with a book, and that's read it twice. And almost never with a health book do I read it twice. I sort of take the knowledge and move on. But I read this book in a night, and it was a lot to digest, so I felt like I needed to read it through again in order to just really absorb and make sure I was understanding everything fully. And more importantly, that it transferred from short-term memory into integrated knowledge in my mind. And so I'm going to introduce the book now. It's called Controlling High Blood Pressure Through Nutrition, Nutritional Supplements, Lifestyle, and Drugs, which sounds like a one-sentence summary of my whole YouTube channel and podcast. So, and it already pushed the right button for me there. Let me go through this book. It's written by Dr. Mark C. Houston, who's one of the preeminent physicians in blood pressure management in the United States and possibly globally. I mean, he seems extremely well regarded. And holistic nutritionist Lee Bell. So when I read about the authors, I always, no offense to the vegetarian vegan crowd, but I sometimes find with the vegetarian vegan nutritionist background is they're just anti other forms of eating. And I'm pleased to report that is not the case. It's this very balanced review. And to my mind, they stick mostly to meta studies whenever possible. And I think when we hit the nutrition section, you'll agree with me that this is really fair and balanced. And that no matter what way you like to eat, whether it's paleo, keto, vegan, vegetarian, there's room for you in this book. There's guidance for you because this book accounts for that and actually might even make you feel better about your dietary choice, no matter what it is. So, and I find that, going to ramble a bit, but I find that to be the case whenever you get someone sort of beyond the Bachelor of Science level in nutrition talking, you get someone who's a master's or PhD. Something about whatever they take in those next couple of years seems to open their mind more to a wider variety of diets and their therapeutic value. So that's just the impression I've had over the years now. I could be wrong. I could have people in the comments telling me how wrong I am. And I'm okay to be wrong. Tell me if I'm wrong. I'm really good with it. I'm here to learn too. So this book is focused on high blood pressure, and high blood pressure is a big topic of conversation for me too, because it's one of the primary diagnoses in terms of high blood pressure tends to come along, and it comes along as an early warning to more serious downstream problems, let's say. And not that high blood pressure isn't serious, obviously, it can cause stroke, can lead to heart attack, but the chronic hypertension can just sit in the background and quietly do damage for years and years. And unless you actually check your blood pressure, you wouldn't even know you had it. So, and that's why it's, a, sort of a primary diagnosis. And then later on comes the kidney damage, the cardiac damage, arteriosclerosis, all these horrendous downstream effects of untreated high blood pressure. So, I mean, chapter 1 really gets into what exactly is hypertension, high blood pressure, and takes you through a couple of patient case studies. Mostly it's stories, and you can probably find, if you have dealt with high blood pressure, you can probably find a case study that's similar to your condition now, to relate to. And chapter 2, we go into the Hypertension Institute program to lower your blood pressure. It's just a summary of their approach. And I'm going to skip that right now because we're actually going to get in detail. The Hypertension Institute program, or HIP. I guess the Hypertension Institute is where Dr. Houston practices out of, and it's an integrated, holistic approach to managing blood pressure. And so this is their official program, and their official sort of, if you come into a program, you can think of it as a flow chart. We're going to check just this and this, and if the result is X, we're going to do this. If the result is Y, we're going to do that other thing. So the Hypertension Institute program is actually, a set of diagnostics that's done, and then the results of the diagnostics determine the course of care, determine the follow-up, determine what to track and measure, determine the diet. So it's a full program here. Okay? So chapter 3, we get into the definition of hypertension, and we get through all the terms, and it breaks down the parts of the arteries and some nifty facts about your arteries. For example, if you took all your arteries and you spread them out flat, if you sliced along the edge and spread them out flat, it would be about 6.5 tennis courts. So it's really pretty much the largest organ of the body if you look at your arteries as an organ. Get into the differences between systolic and diastolic pressure and what the implications are if you're high systolic, which happens naturally as you age, versus high systolic and high diastolic versus just high diastolic. We get into some terms such as essential hypertension, which means you have high blood pressure, but there's no obvious cause. You're not a smoker. You're not overweight. So they would just call that essential hypertension. Gets into properly measuring your blood pressure. And this is something I think everyone does wrong. I mean, everyone does it wrong. I've never been to a doctor's office where they actually measure your blood pressure the way that it's measured when they're doing studies on blood pressure and determining risks for blood pressure. So they really get into why you need to just sit and relax for 5 minutes and not be talking. And then you check your blood pressure. You're in the proper position. You're seated at the table. Your arm is the height of your heart. You've relaxed for 5 minutes. You're not stressed. Basically, you're setting up the optimal conditions so that your blood pressure is a true resting blood pressure. And then you take your blood pressure. And then during the diagnostic phase, obviously at the clinic, they check the blood pressure a variety of ways. And they consider the gold standard is a 24-hour ambulatory blood pressure monitoring, something no one's ever suggested I get done in my life here in Canada. And I don't know anyone who's ever had it. So I don't think it's done much in Canada, but it sounds like this clinic, they're really fond of it. And I think it's a great idea, because how do you know if you have high blood pressure in your sleep? They also get into like white coat syndrome and what they call MAST, which is the opposite of white coat syndrome. So white coat syndrome means whenever someone professional is taking your blood pressure, it's much higher. And I have that. And I was always under the impression that white coat syndrome is I mean, it's just sort of this abnormality, and it's not an indicator of everything. So just I go home and I take my blood pressure and I keep a log, and as long as I'm good on that log, then my blood pressure is good. But actually, he goes into the science of people with white coat syndrome, and if you have white coat syndrome, it's actually a predictor of downstream problems. So, white coat syndrome itself should be a bit of a warning sign that you need to get better control of your blood pressure. And it sort of makes sense if you think about it, because what is causing your blood pressure to be jacked around a white coat is obviously some sort of stress or anxiety. Well, don't you have other situations in your life that create stress and anxiety? Wouldn't that have the equivalent effect on your blood pressure as white coat syndrome? So when you stop and think about it, it makes perfect sense that white coat syndrome is actually an indicator of possible problem, and that people with white coat syndrome compared to people with no high blood pressure problems at all have worse outcomes. So that makes total sense to me. Masked is the other term. So these people, they went. It's kind of like the presence of the doctor calms them down, so their blood pressures actually looks good in the clinic, but when they're doing testing it at home, it's high. So it's the reverse of that, and it has the same sort of predictive value as white coat syndrome. So one of the key things in the breakdown of the artery in terms of the anatomy and physiology is that he gets into the artery. You start to think of it. He explains how the artery is almost think of it as a muscle. So you want your arteries like nice and flexible, and if the one of the layers around your artery, and I'm trying to keep this really simple, okay? You just think of it as a muscle, and it will contract and relax. And it contracts and relax based on, stress, nutrients in your diet, presence of nitrous oxide. All these things will contract or relax that muscle. And it's not like a muscle, and like you can't just you can flex your bicep and make your bicep stand up, but you can't flex your arteries, right? Like that's determined by things that are outside of your conscious control. So you have to sort of set the stage for your arteries to be more relaxed more often, most of the time. And that's just putting it quite simply. So if you buy the book, he'll take you through the different layers of your artery and how different life stresses and genetic factors and diets and comorbidities affect those different layers. And it's a chapter I found immensely satisfying to read. Um, Chapter 5, we start to stress that there's basically three, there's almost unlimited causes of hypertension, but there's three finite responses or outcomes. And that's kind of critical to think about, because it can be multi-causal: smoking, drinking, lack of exercise, life stress, genetics, bad luck. You live in an area with high air pollution. I mean, who knows, right? The all all the responses are easily grouped into three groups. You end up with one result, um, oxidative stress. So you could think of the things that kind of push you towards having high blood pressure. You can think of it, use the term insults. So these are insults to your arteries, but the results are oxidative stress, immune dysfunction, and inflammation. Okay, so inflammation is due to white blood cells called T cells and B cells that attack invaders, and they're inappropriately activating, right? So and oxidative stress. Everyone who's ever heard of the benefits of antioxidant is quite familiar with the idea that we don't want oxidative stress, but it's an imbalance of the radical oxygen species, or basically, the bad molecules. You could think of it. These are usually in balance with the antioxidant defenses. So you can think of there's a constant war going on between the oxidatives and the antioxidants, and so if the army on the oxidative side gets a lot more soldiers and you don't have enough soldiers on the antioxidative side, I mean, it starts to shift the balance and vice versa. So they call that oxidative stress. And then finally you have inflammation, and inflammation is exactly what it sounds like. Things get swollen and puffy, and so that too will cause your arteries to shrink and harden. And so if you think about your arteries as like a hose, you have the artery diameter, how big that hose is, but you also have how flexible it is. And so those are two main characteristics that will cause you to have high blood pressure problems. Is you can think of the hose diameter shrinks because that muscle around it is tightening, or it's just inflexible, and thus it's easy to damage, and that creates inflammation, oxidative stress, and that sort of stuff. So it was you can probably hear me flipping through the pages as I go through this, but it was is really interesting. So you can think of 100 or infinite different ways to insult your arteries, but your arteries have basically three responses to all that insult: oxidative stress, inflammation, and immune dysfunction. Where again, the immune dysfunction will be something is triggering the immune system to overactivate when it's not necessarily wanted. So, speaking of balance, chapter 6, we talk about the fact that your arteries are always being damaged. They're always being a little bit insulted. It's just part of life. So, there's an injury and then there's a repair cycle. So, when the repairs can no longer keep up with the amount of injuries, that's where you start to shift towards those three possible outcomes of oxidative stress, immune dysfunction, and inflammation. So, if you can just stop, especially if you have high blood pressure before it's gotten really bad, before you've got, terrible arteriosclerosis, the fact that if you can reduce the insult to where the repair cycle can start to keep up and even get ahead, you can reverse um, you can reverse the damage. So that's why your doctor should be checking your blood pressure every visit, and that's why you should be checking your blood pressure regularly. Like those little machines at the pharmacy, next time you're there, stick your arm in it and check your blood pressure. Just do it. You may, and again, you're supposed to sit for 5 minutes, but to me, the 5 minutes is worth discovery that you have high blood pressure and you can do something about it. So, um, this white coat syndrome, and getting back to it, and masked hypertension, there's also gender differences in high blood pressure. So it has a whole chapter that gets into all that. But again, the key takeaway is that if you have white coat syndrome or masked hypertension, just consider it a form of hypertension or high blood pressure, and take action. That's a signal that you need to take action. Okay. The excess blood pressure, again, chapter 8, we go through a whole list of ways it damages um, our bodies. So, angina, heart attack, myocardial infarction, congestive heart failure, stroke, or cerebral vascular accident, which is a type of stroke, vascular dementia. Do you want something called vascular dementia? Kidney disease and chronic kidney disease, aneurysm, eyesight problems, eye problems, and possibly damage to your eye, endothelial dysfunction, arterial damage, arteriosclerosis, atherosclerosis. So all these downstream effects are are directly caused by having high blood pressure, and that whole cycle of insults to your arteries occurring faster than your natural repair mechanisms can keep up. And as you get older, those natural repair mechanisms they slow down a bit, right? So the insults in our lives and the insults to our body, they don't slow down just because we're getting older. But our ability to keep up with it all certainly slows down a bit. So you'll start to see in the general population a creeping amount of high blood pressure as they go, especially systolic blood pressure naturally increases with age. And there is a line of thought that, if you're, let's say, 75 years old and your blood pressure is, 145 over 80, well, that's fine because, systolic goes up with your age. But I would, my assessment of Dr. Houston's opinion based on this book is that that's actually actionable, and you would want to get that 145 systolic down, even if you were 75, at least with life. Especially because, again, so imagine your high blood pressure is, I mean, there's insults to our body, this concept of insults to our arteries, creating a scenario where we have high blood pressure, but now the high blood pressure is an insult to your kidneys, is an insult to your liver, is an insult to your heart and brain. And they have their own repair processes that may not be able to keep up to that. So if you think about a connected system with downstream effects, you start to realize why high blood pressure is so important. The other thing is you can go through some stats on high blood pressure. About high blood pressure is basically the number one cause of hospitalizations in the US. It causes more hospitalization because of high blood pressure itself, but also the damaging downstream conditions that it causes. So he gives a checklist of something like 31 possible signs you might have high blood pressure. So you could sort of go through that. So 31 risks that you might have high blood pressure. And if you score high there, you should probably go get it checked out. He goes through some of the standard tests and their value. And a lot of this I'm not going to cover here because I want to get to the good stuff. And he goes into, of course, the genetic environment. And he's right down with the idea that if you're following the idea of genes versus gene expression versus environment. So he ties that together for hypertension. But the idea is this: the genes are your heredity. That's what you're born with. Both your parents had high blood pressure and their parents had high blood pressure. Chances are you have the genes for high blood pressure. But then there's also gene expression. So just because you have these genes doesn't mean they're active. So environment, and that includes your food, your exercise, stress in your life, can actually cause those genes to express or to activate. And so you're already more likely, more susceptible to hypertension because you're genetically wired for it. And now you've gone into an environment that is more likely to set off, have those genes expressing. So you're more like, just in short, a lot more likely to have hypertension. And it might be even harder to treat if that's the case. So the big categories of environment, diet, specific nutrients, genes relevant to cardiovascular risk. There's genes relevant to hypertension. So all these combine together in sort of you can think of it as a big soup, and the bigger your bowl of soup, the more likely you are to have high blood pressure. So the HIP program, Hypertension Institute program, and its approach to hypertension diagnosis and treatment. So it sounds like they do an extremely thorough diagnostic. Check each limb, to check your blood pressure on each limb, including your legs, seated, standing. If there's any doubts, it's 24-hour ambulatory monitoring where you wear the monitor for 24 hours. They check it in your sleep. The treatment is, if you have high blood pressure, to start treatment early and aggressively and get it under control as soon as possible. And they cite some studies that show their approach works. For diet, these are my favorite chapters. Whenever a book starts getting into nutrition and diet, I'm all ears. But basically, they go into why the DASH diets haven't gone off so well. And of course, the HIP program, they have their own approach to diet. And I really love their approach, and you'll see why when I get to it. They do have a focus on detoxifying. And I think this couples with the idea of, you're insulting your arteries. Well, they tie the high blood pressure to liver, much as I have done in another video. Is your liver causing your ectopic beats, which actually turned out to be one of my more videos. But they're tying in the same way. Your liver is the master detoxifier in your body, and so they're out to detoxify your liver. So to me, if you think you can actually just eat a certain way for a week and it causes all the quote unquote toxins to leave your liver, that is a perfectly valid way to look at it from my point of view. But the way I look at it is, your liver, your arteries, your heart, your brain, things in our environment are creating insult to those. So if we can just back off and let our natural repair cycles just work the way they're always working, but actually keep up and even get ahead of the situation. So I would consider that detoxing. That's how I look at detox. But you can look at it either way. The point is you stop the insult and you stop the damage so that your repair cycles can kick in. So they do have a phase in their nutrition program where they're just really out to and and since liver detoxes seem to be really popular, especially around the time this book was published in 2019, I'm not surprised. And they look at what you're putting on your plate and the kind of foods, and as well, they get into intermittent fasting. Big proponents of the 16-8 intermittent fasting, which is again one I push. I think that's the most manageable type of fast is 16-10 or 4. So 16 hours fasting, 8-hour eating window, or even a 14-10, or even a 12 hours fasting, 12 hours eating benefits. But I think the sweet spot is 16 hours fasting, 8 hours eating window. And they seem to agree with that. And they provided a bunch of citation. Everything in this book is linked to a boatload of citation that you can go look up if you wish. So the diet is a whole foods, get rid of the processed stuff, get rid of the refined sugar, get rid of the grains. Because, I mean, let's face it, everything made out of grain is refined. So, very much in line with everything I've said. I'm really happy about that. They go into the whole protein. So, they go looking at it from the macro level. They know and they've shown with the evidence and the citation that a high protein diet does better for blood pressure. And so likely anything that improves your blood pressure probably improves all your cardiac health, right? So, and then they went through the science and they compared the meta studies, high protein diet, animal protein, high protein diet, vegetable protein, both those diets improve your blood pressure. The war between vegans and carnivores just needs to die, just needs to go away. In this book, they give the edge to the vegans, but it's not really that big of an edge. And if you can hear my Yorkie barking in the background, we'll just have to put up with it. But it's such a minor lead. However, the high protein diet with processed meat, nasty, terrible. So if you're going to eat a high protein diet, make sure it's not fake meat and not processed meat. So it can't be vegetarian, fake, processed chicken strips. It can't be, cured salamis or bacon. Has to be just natural meat. And the focus they put on is what they call clean protein. So this is your small fish like sardines, grass-fed beef and bison, elk. They would consider these clean protein, or factory farmed beef. They would probably consider it not so clean protein, but definitely processed meats not on this nutrition plan. Take them out of their diet. I have to agree with that, I'm afraid. Again, I strongly feel it's more important to eat whole foods that don't have a nutrition label, that don't have an ingredients list, than it is to worry about whether you're vegetarian or low carb or whatever. Get on real food and then optimize from there. So, having said that, if that is one of your approaches, reading this book will help you do that approach better for better cardiac health. And then the next chapter is like, again, I just love this, but they stress that the diet doesn't matter if you can't turn it into habits and rituals. So they get into cognitive behavioral therapy strategies. And in their HIT program, they actually have therapists that you would go with so that you can take habits and form them into rituals so they become long lasting things. So if you've seen my web series Making the Shift, you know that is, they just plug that straight from my heart. Just wonderful to see that. So and the example they give in the book one example of a habit that I hadn't heard before is the idea of a throne, and it's to get you to eat mindfully. Eating mindfully is so, and when you set a throne, the idea is you pick one chair in your house, and that's where you're going to take all your nutrition and all your hydration. So you pick that chair, and then when you want a snack, well, you go sit in that chair and you have your snack in that chair, or you have your meals in that chair. And the thing about your throne is when you're in the throne, you can talk to other family members in that, but what you can't do is look at your phone. You can't watch YouTube videos or Netflix. You're there to eat mindfully. So you sit and eat either with your family or by yourself, and you eat mindfully. So I thought the concept of that's my throne. I thought that was just a great little cognitive trick you can use to be mindful. And I've actually started doing that. Since I've read this book, I've stopped bringing food down to my desk. I mean, I bring my that's okay. There's 0-calorie drinks, but I don't bring food to my desk anymore. Now, when I have a snack, I stay up in the dining room and I have my little snack in my throne. I don't bring it to my desk anymore. So I think that's a great habit. I feel better for doing it. And chapter 15, treatment of hypertension through nutraceutical supplements. So here's his supplements. And this book is the motherlode gold mine. If you spend hours on the internet looking at supplements and what their possible benefits are, okay, Dr. Houston and holistic nutritionist Lee Bell have done the work for you. So you can go through this. So sodium, obviously, they start with sodium because that's always the big culprit. And the next is potassium, magnesium. So anyone who's following my channel is probably all really familiar with sodium, potassium, magnesium. And the sodium, potassium is more with them. It's more about the balance. You want to reduce your sodium, but you want 4 times as much potassium as you have sodium. So the other supplements and that he covers zinc, protein, and we talked about protein, arginine, taurine, 2 of my favorites, the 2 that helped end my ectopic beats. I still barely have any ectopic beats. I fully credit arginine and taurine. Omega-3s, omega-6 monounsaturated fats, and talks about how they weave in and out of the Mediterranean diet. Vitamin C, vitamin E, D3, B6, resveratrol, pomegranate juice, lycopene, coenzyme Q10, both forms, ALA or alpha lipoic acid, garlic, seaweed, cocoa, melatonin, grapeseed extract, beetroot juice, nitrates, extracts, teas, carnitine, fiber, sesame, N-acetylcysteine, which I take, hawthorn, certain probiotic, and how to put them all together in a meaningful way. And he lists what he considers the best possible sources for each. And he also goes through the literature for each and shows the impact it's been shown to have on the blood pressure and health and the possible downsides. So really, you could read chapter 15 of this book and get your money's worth for this book, as far as I'm concerned. If you're buying supplements, now the sources he lists are the best possible quality, and they're all way beyond the money I would spend. I'm quite happy to get my carnitine, a less expensive brand, but I mean, if you use the sources he lists, obviously you're going to get tighter control on the quality. So this is a decision you can make, but at least you'll be hitting your golf ball onto the right green after reading the supplement guide. And it's the supplement guide. It's just fantastic. Lifestyle changes and blood pressure. So exercise. He's kind of won me over a bit on the exercise. As you know, my view is that you should get your cardio base built before you engage in strength training. You should just focus on getting your cardio base built. I recommend walking an hour a day at first until you can actually do an hour a day of walking and feel comfortable doing an hour a day walking where it's not so difficult for you. I would consider that at least to be there before you start strength training. But he actually has a whole different tact, and he's kind of won me over as a generalized recommendation. And the thought is, let's say you had an hour a day to exercise. Well, you should be spending 20 minutes doing cardio and 40 minutes strength training. But his strength training is not perhaps what you might think of. So the strength is more focused on what the bodybuilders would consider a rep range of vascular development. So it will build mass, it will build muscle size in men, it'll make women look more toned, but also develops the musculature and the blood flow through the muscles by doing these high reps. So on his ABCT, aerobics, build, contour, and tone program, the aerobics is 20 minutes and it's not prioritized. The priority is the strength. So the build, contour, and tone portion. So the strength you would do alternating days. So maybe Monday you would do your upper body, Tuesday your lower body, or if you switched it up, you could do, Monday pushes, Tuesday pulls, Wednesday horizontal pushes, Thursday horizontal pulls, and you could break it up however. But the point is that you're doing some strength every day. And then after your 40 minutes of strength training, you're doing 20 minutes of cardio, which is interval based, where you're doing at least 1 minute of high intensity for 3 minutes of low intensity. And high intensity means pretty high. You should be huffing and puffing after 1 minute. And low intensity is pretty low, 50% of heart rate max. So it's a good, really easy 3 minutes. And then you can make that more intense by shortening up the low intensity portion. So you could go high intensity 1 minute, low intensity 3 minutes. Later you could go high intensity 1 minute, low intensity 2 minutes, and that naturally means within 20 minutes you'll get more repetitions of that. But the weightlifting or the strength training, it's a mix of typical strength training and also core development. So 1 or 2 of those days each week you should be doing core exercises, or you can do it like in a sample workouts where every day you're doing 1 core exercise. So a plank, a side plank, reverse hypers, whatever core exercise you adopt can be part of that. And the strength building, you actually start at 75% max. So let's say you can bench press 100 pounds. So you would bench press 75 pounds for 12 reps. And then you'd actually go less weight and do more reps until you did like 4 sets. And your last set, you're doing like 20 reps. So that's, if you've ever lifted in this style or done weightlifting where you do draw sets, you get this huge lactic acid buildup in the muscles that then the arteries have to come and clear it away. And that's why they call this vascular style of training in the bodybuilders. They call it vascular development, because you're just exhausting the muscle in a really rapid way, causing it to build up lactic acid, and then you give it that 1 minute rest in between sets, and your body only has 1 minute to clear out all that lactic acid before you hit it again. So you're giving your body practice at clearing away the junk, making it get good at clearing away the junk. So the way the body adapts to it is by teaching your arterial muscles to relax so that your arteries dilate more and let the blood flow move through force. So I started to think about that. Actually, that's a really great idea for anyone with high blood pressure. That's a really good case for them to be doing strength training as soon as they possibly can, even if it's just with rubber bands, even if it's just cans of soup or body weight. He's sort of won me over there. It's hard to argue with that logic because you can directly impact you can directly train your vascular system through weight training. So why wouldn't you do it? Why wouldn't you do that? So he's kind of won me over. And then they go through all the basic stuff. What about energy drinks, nutrition before, during, or after exercise? Some example programs in that. It's a fantastic chapter. Also, of course, they talk about how fight obesity. This stuff is true. I believe it's true that a combination of strength training plus cardio is way more effective for weight loss than just cardio. Although you can achieve it with just cardio or just weightlifting. If your goal is weight loss and health, a mix of both is likely best. And then tucked in here, I guess didn't quite fit him into the supplements section, but so he's considering this more the lifestyle changes, exercise, also caffeine. Obviously wants you to do a trial with 0 caffeine to see how that affects you. Alcohol, recommends completely abstaining from alcohol, or at least reducing to a minimum amount. He gives you a quite tolerable daily amount, which you could reduce to. And of course, stress, anxiety, and sleep. And we all know about sleep apnea and CPAP and the importance of uncovering your sleep apnea. Fantastic section on lifestyle. And in chapter 17, he gets into the drugs. And it's a really, chapter 17 is only like 8 pages, and probably half of that's like citations. So it's really just skimming through the drug categories, and it's not. Teaching patients everything about a drug is not necessary. I think he wants to make the point that there's some categories of drugs that have fallen out of favor for treating high blood pressure, but are still widely prescribed. So something like he calls the old beta blockers. So he's quite convinced that very few of the old beta blockers, quote unquote, are effective for reducing all-cause mortality and reducing and creating blood pressure control, like metoprolol. A lot of us are on metoprolol, and our doctors are like, well, it'll help your blood pressure too. Well, it turns out, according to him, no, it doesn't. Here's some science that backs him up. But he does recommend a couple beta blockers. And, and the other thing he goes on, he's really stressing on the diuretic that, some of the diuretics we're using, there's much better alternatives now. So, but to me, this is more a section you just show to your doctor, show them, snapshot a couple of paragraphs and say, hey, I'm on this. Do you think this one might be better? Like, it's a conversation you need to have with your doctor. So, and then the last chapter is just a little wrap up, and it gets into, again, the predictors of your hypertension. So I'm just going to flip to that page now. Bear with me. But it actually has a risk stratification, a little quiz you can take. And I don't like spoiling the book, but how about we just look at a few questions on this quiz together, okay? And if your total score when you're done this quiz is over 15, you're at a high risk for developing blood pressure problems. If you're between 8 and 15, you're at a moderate risk. So, you know what? I don't think it's going to spoil the book to go through them. Let's go through them. Let's take our quiz together. Okay. So genetics. If one of your parents had high blood pressure, you have a 25% chance of developing it yourself. If both parents, then 50%. So, if you have one parent, you get 3 points. If you have two parents with high blood pressure, you get 6 points. If you have two parents, and you also have a sibling who had high blood pressure before the age of 50, you're at 7 points. Okay. If you're African American or Hispanic, you get an extra 2 points. If you're Asian, Native American, or Indian, you get 1 point. So right away, you can tell that the genetics is a huge component and predictor of whether you might have some high blood pressure. 2 points if you're a male, 1 point if you're female. So you get 1 point no matter what sex you are, but men get an extra point. If you're over 60, you get 1 more point. If your resting heart rate is over 80, you get 1 point. Well, mine's under 50. I wonder if I get to deduct for that. If you have abnormal blood glucose, and this is something I forgot to cover earlier, but controlling your insulin and measuring your insulin is a big part of his lifestyle modification. And to me, it's really worth doing. I own a blood glucose monitor, and I spot test myself to make sure that I'm doing okay. But if you have a high A1C, you get a point. Kidney disease, or you have your albumin test in your urine is not great, you get 2 points. If you're overweight, you get 2 points. Systolic blood pressure over 200. Hypertensive response to exercise. Okay, so if you do exercise and after, or just right after you finish an intense set, if your systolic is over 200, they check your blood pressure right there, you probably have problems with high blood. If you have white coat syndrome, you get a point for that, or masked hypertension. So we talked about that earlier in the video. Excessive alcohol consumption over 20 grams a day in men or 10 in women, 2 points. Sorry, ladies, I guess you only get to drink half as much. Medications and drug abuse for a list of these. So you get 1 point for those things you're abusing. Tobacco use gives you a point. Poor diet with high sodium, low potassium, low magnesium, not enough fruits and vegetables. So poor diet, you get 3 points. Poor diet's obviously a big one. Too much emotional stress, anxiety, hostility, or depression, 2 points. Low income, 1 point. Or low education level, 1 point. And these are all based on statistical probability. It's not like, for example, less education. It's not meant as an insult to someone who maybe left high school at grade 10. It's just statistically they have higher blood pressure, or someone with lower income, or someone with too much emotional stress, statistically will have higher blood pressure. So I've gone through this in some detail, but when you read the book, it's really going to upgrade your knowledge of your body and make you far more acutely aware of how you can take control of your blood pressure and thus your cardiac health. Because almost everything in this book, just about any intervention you can do that improves your artery health, is also going to improve your cardiac health, possibly your cerebral vascular health, possibly your cardiorespiratory health and fitness. It's just going to pay off. And he gets into the two-way relationships, like we've talked about on my live show, where I have what I call my evolving health model, where I show the two-way relationships between things like fatty liver and high blood pressure, fatty liver and diabetes, diabetes and high blood pressure, diabetes and stroke. It's this two-way relationship. So he really stresses that as well. So for me, this book served as a confirmation of everything I had read and researched and learned through trial and error on my own. I mean, in Canada, I didn't have a HIP program. I didn't have Hypertensive Integrated Institute to help me figure all this out, right? I was told, well, go home and lose 50 pounds and cut out the refined carbs. So, fair enough, but I had to research all this independently. If I had had this book 2 years ago, I probably could have saved 3-4 months and got a head start. So, if you like the book, The AFib Cure, imagine the value of that book times 100. And that's a good book, but it's more of a motivational book. This is more of a knowledge book. This is going to give you a big knowledge dump into your brain about controlling your high blood pressure. So, once again, the book is Controlling High Blood Pressure Through Nutrition, Nutritional Supplements, Lifestyle, and Drugs. Authors Dr. Mark C. Houston, holistic nutritionist Lee Bell. It's from CRC Press, Taylor and Francis Group. I bought mine on Amazon. I'll leave a link down in the description to Amazon. I'm an Amazon affiliate, so if you use the link, it doesn't affect the price of the book, but I get a small commission, and I thank you for that if you do use the link. And if you do buy the book, and leave a comment and let me know what you thought of it, and let's tell me what maybe the biggest thing you learned from this book and how this book has benefited you, because anyone who reads this book is going to benefit from it. So, and I'm just flipping through it. There's even a section of recipes that fit well on his nutrition plan. So you just have some recipes if you want to start off with, and they're very whole foods, heart healthy, focus recipes that focus on extra virgin olive oil and just wonderfully flavored natural food recipes. So that's a major focus of the nutrition plan. And I just think this book is worth it. And I hope for your health that you read a book like this. Maybe your condition is AFib. If it is, maybe you've read The AFib Cure. And I think that's the initial book to read if you have AFib. But I think everyone with any cardiac concerns, be it genetic, runs in your family, right down to I've got valve problems or whatever, I feel like they would benefit from this book and talking to their doctor and saying, hey, I'm thinking of starting this lifestyle modification program, and I'll be doing 20 minutes of interval sessions and 40 minutes of light weightlifting 6 days a week, and I'm going to eat a whole foods diet. And if your doctor gets behind it, man, you just have momentum behind you. You'll have their support. And another thing in this book stresses is patient ownership. You need to own your outcomes. Okay, so you need to be checking your blood pressure at home, checking your blood sugar. They recommend if you need to lose weight that you should be using an impedance measurement device. And hold on, I've got one. I'll put a link down in the description, but one of these will keep you honest, right? And when you're measuring your body fat percentage with one of these, I mean, obviously you want to measure your body weight, but you should, like your body weight, your body fat percentage is going to sort of move up and down each day. But what you're looking at is for a trend over time. You should see it trending down over time. So over 6 months, you should see your body fat percentage go from like 40 to 35. And if it's 36 one day and 34 the next day and 37 one day, then 32 the next day, don't worry about it. Look for the trend. Is it trending down? And of course, you can use something like if you have Apple Watch with Apple Health, if that's your thing, or you have the Android environment, or you just use a notepad. I mean, it's really important to track all this and bring your notes into the doctor when you go. Show them what you've tracked, and just show the teamwork. Show them that you've made yourself accountable and that you're owning this. And I think you're going to find you have success beyond what you imagine possible. And I know I have listeners that they're not in a good place for health, or they're much older, and it's really difficult to start a program. I had one listener comment the other day that, I mean, everything I recommend is way beyond their ability to do in terms of exercise. And I think that's just more important to talk to your doctor and say, I want to exercise, I don't know where to start, because they can refer you to cardiac rehab centers that will actually help you to exercise and get you to the point where you could start walking every day. So there is something you could do, and they'll give you some stuff. Like there's stuff you can do with surgical tubes that'll build your muscular strength, and building your muscular strength will make it easier to walk, and that means you can actually walk, and it cannot be so painful, or it can help address some of the balance issues you might be having. So really, you just, if you don't know what to do, the first step is admitting you don't know what to do, and then talking to your doctor and saying, what, where can I go? What can I do? Because, I'm obviously not doing well on my own, and I'm willing to put in the work, but I need some guidance and some coaching and some assistance. And if you don't have the guts to say it, write it down. And then when he comes in, just hand it to him as a note. Like just get it out and just enlist your doctor as a support person. Don't just see them as someone there to come in and give you orders. Do this, do this, do this, and take this pill. No, just say, you know what, I'm down with all these medical things you want me to do, but this is what I need, and they'll be right behind you. I'm sure of it. If they're not, then I mean, you need to doctor shop. If a doctor's not supportive of you trying to live a more healthy lifestyle, then you need to doctor shop. I don't even know what that person's doing practicing medicine, to be honest, but talk to them. And that's my advice. So pick up the book, and enjoy it. Like just read a chapter a night if it's not your reading style. I would say that it's written at about a grade 10 level. So if you can read at a grade 10 level, you have no trouble understanding it. If you're maybe a grade 8 level, or you're out of practice, might take you a little longer, but I don't think there's any concepts in here he hasn't broken down simple enough that the layperson can understand, even though the audience seems to be more for a clinic. Hey, here's something your clinic could implement. I really think there's a lot of benefit as a patient to reading something like this. So this podcast, I've really rambled on, and I was deliberate, because I think one thing I don't like about YouTube is that you can't just ramble your thoughts out, because people just tune out. But I find on the podcast, I actually enjoy it, the odd episode where the podcast hosts I listen to, they just sort of give themselves all the time in the world and really explore something. So I just wanted to do that with this book. And I'm still going to do my 10-minute YouTube video about this book, but I might do that next week or the week after. Who knows? And that'll be, fancifully edited and all that I usually do. But I really think that the gold mine is the book itself. It's not not anything that I'm going to put out. I mean, the best thing that I would imagine could happen is that people actually buy this book and implement the advice, and then there's no longer a need for my channel and my podcast. That would be the best possible outcome. I know that's not likely, but that would be the best possible outcome. So, on that note, I'm just going to thank you for listening. And don't forget to follow and throw a review on Apple, iTunes, or Spotify, or whatever platform you're listening on. It all helps. I much appreciate it. I wish you all a great day. This is your friend, Big Northern Bear. Out. Hi, this is Big Northern Bear. Sorry for this interruption, but do you ever find yourself dealing with annoying ectopic beats? That irregular offbeat sensation in your chest that can feel like your heart is skipping a beat or fluttering? I know I did. It was unsettling and I wanted a solution. After extensive research and trial, I found a combination of inexpensive, low-cost supplements and regular exercise that reduce my ectopic beats and palpitations by a whopping 95%. And I want to share these with you. Just check the description of this podcast for a link to the very same low-cost supplements that I used. It really made a difference for me. But remember, before you start any supplement regime or exercise program, it's important to consult with your doctor. Supplements can sometimes interfere with your medications, and you want to make sure that you're making safe and informed decisions about your health. And while we're talking about safety, a little bit further, supplements are not approved for the specific treatment of any medical condition. My experience is personal, but it inspired me to share these supplements with you in hopes that they might help you as they have helped me. Check the description for the link today. Let's take control of our heart health, one beat at a time. Back to our show.